Hi, Dr. Henry. Is there a certain either percentage or number of doses that will be redirected to second doses? Like if we're sort of averaging 60,000 doses a day, will that supply overall, will that dosage increase, or will it be sort of a percentage siphoned off for second dosage?
Not really either of those. So what we have done is planned, and this is why it's taken some time for us to get there. What we've done is planned the appointments and the doses to each of the clinics based on the streams that we have on the go right now. So that's anybody from age 12 and up who's requiring first doses, and then we'll have second doses in those same clinics. So it really is about portioning out the clinic appointments and the vaccine to meet those appointments. So it really is kind of a large logistical challenge of making sure we are where we are now. We know how many people are in each of the cohorts that are due for dose 1, and now starting with dose 2 and where they are around the province. So we will be moving full steam ahead on both of those in the next few weeks.
With these vaccine second doses, is this like the final frontier that we're facing to get back to life as we know it? You know, people talk about Melbourne now and they see them locking down, but their vaccination rate is a smidgen of ours. So once we get these second doses heading into the fall, is that going to be it? Maybe a booster shot somewhere down the line, or is there a possibility of another, COVID brick in the head coming our way?
I wish I knew the answer to that. I think I'll be wearing a helmet for at least another year waiting for those bricks. But, there's a couple of things about it. The first dose, and this is, how we've been approaching this and looking at this, similar to some countries around the world. The first dose really is about giving everybody a very high level of protection as quickly as possible. And we know that that works. I've presented the data. The vaccine effectiveness is at least 70%, which means in the real world, for people over the age of 70, a single dose has stopped 70% of infections. So that's the good news. The second dose really is about giving that added level of protection, another 10 to 15% to you as an individual. But it also does contribute to our collective protection. But it is much more about the individual protection, and that's why we've gone back again to ensuring that people who are most at risk are getting their second dose first. But we do know that there are pockets where even the first dose is low, and it is going to be important for us to keep on pushing the importance for an individual, for your own protection, to allow you to get back to doing things, but also for the community to have their first dose. And there's some parts of the province, and you can look on our interactive website to see where those are, where we really do need to continue to step up. And places like Melbourne are examples. There's a couple of other countries that have very high first rate immunization and even second dose immunization, like Malta, for example, where they continue to have clusters and outbreaks that lead to people being hospitalized, to deaths even. So we need to pay attention to that. Getting the second dose does protect me better, but it protects all of us better. And we're moving that up for a couple of reasons. One, because we want to get all of the protection as high as we can when there's still a lot of transmission happening in countries around the world, and we can have introduction of newer strains. So that's important. But we don't yet know if we're going to need booster doses at some point, or if some people will need them, if some people will never mount enough of a protection response on their own. What we do believe is that as we go into the fall, we have high levels of protection in the community, high levels of second dose protection, so that extra bit for all of us, that we should be able to get through this respiratory season. We may need at some point to have a booster dose. We don't know yet. This virus is mutating at a slower rate than things like influenza, But it is changing, and we've seen that with these variants where sometimes if there's a lot of transmission of the virus and more mutations, some of them will confer a survival advantage or a transmission advantage. So that's what we're seeing around the world. We're seeing it in India, we're seeing it in Brazil, in countries where there's a lot of virus circulating. So we need to get as high a level of protection as we can in BC and in Canada to protect us as this virus is still circulating globally. What might happen and what we are watching for and will need to continue to watch for is if a strain arises around the world that where it is not as amenable to the protection from vaccination. So that's something that we can't predict, but we need to be able to monitor for, and in that case, we may need to have a booster dose sooner rather than later. So all of those are possibilities that I just don't have answers for, but that we've been thinking through where they might lead and down the line and what the responses to those might be. That's why it's still so important to ensure that we have other vaccines that are in development, even if it may be some time before they're approved for use. And I'm thinking of Medicago and Novavax. It's also why we need to really continue to push on having domestic vaccine capacity in Canada to be able to develop booster doses if we need them.
For second doses, beyond the priority groups of clinically vulnerable and then starting with 70 plus, what about those who were bumped up earlier for dose one because they lived in a hot spot? Does that mean they'll be bumped up again accordingly? And will second dose clinics be set up in hotspot communities?
The short answer is yes. So it's all going to be phased in the same way it was done for dose one. So it's based on when you received your dose. And so for some communities, we think of Prince Rupert, for example, where we went in and did the entire community approach. That will happen for second doses, and that will be coming up very soon. For other communities, it's not that easy. For some of the larger communities, the hotspot ones we identified more recently that are larger, it just means that people will receive their invitation to come for their second dose sooner. And so everybody will be moved up to 8 weeks at the latest. So if you just received it early in May, then you should expect to receive your second dose invite in early July.